afternoon, everyone, or maybe morning to some. Welcome to the House Democratic Caucus Task Force on Aging and Families Roundtable on the COVID-19 crisis in America's nursing home. First, let me just say a thank you to the caucus leadership, Hakeem Jeffries, as well as Catherine Clark, who you'll hear from in a minute, and the staff that made this happen. We have lost over 50,000 long-term care residents and staff in the coronavirus, to the coronavirus. Think of that. That number represents indescribable pain for the families and the friends who have lost their loved ones, and an immense failure of leadership from the Trump administration. House Democrats are committed to taking action to stop this unnecessary loss of life, and we have an esteemed group of stakeholders that are joining us today to help us understand what that should look like. I'm going to yield my time first to Catherine Clark, but let me thank so much the co-chairs of this task force, as well as the vice chairs that are here. You'll be able to hear from all of them, and it is their participation that makes this such a vibrant part of the larger Democratic caucus. First, let me yield to Catherine Clark, the vice chair of the Democratic caucus.
Thank you so much, Jan. It is good to see you. And I really want to extend my gratitude to the Task Force on Aging and Families. Like so many things, this pandemic has not created issues, but has certainly magnified their deadly impact. And I am so grateful that the Task Force and the Democratic Caucus have been working on the issues that we're going to be talking about today. Access to healthcare, making sure that nursing homes and long-term living facilities are of quality and are safe. Food and financial security, protecting pensions, scams, all the issues that we have seen arise for families and older Americans during this pandemic. And they're issues that have been the focus of this task force. And in my district, I lost 1/3 of the residents in just one nursing home. So I am very thankful for your request and the co-chairs of this task force coming together, asking for the $25 billion in additional assistance to make sure that we can get testing levels and PPE and help the staff and residents of these facilities regain their security. So I just want to say thank you again. I'm grateful to be here with our guests today. And as a caucus, we stand with your work and are deeply appreciative. Thank you, Jan.
Thank you so much. And now it is my pleasure to ask Doris Matsui to take over by introducing our first panel. And Doris and I founded this task force some years ago. Now we have Connor Lamb as a co-chair as well. So Doris Matsui, take it away.
Okay, well, thank you so much, Jan. Thank you very much for your leadership. And I want to thank Catherine Clark for her leadership in the caucus. And thanks to all our guests and my task force colleagues for participating in this very important discussion today. Nursing homes and long-term facilities across the country really continue to be ravaged by the COVID-19 pandemic. And it's unavoidable when you think about unacceptable for elderly care to disproportionately endure the brunt of the virus. And as we move forward in reopening our communities, we cannot lose sight of the failed leadership and the shortcomings in the business of nursing care that continue to exacerbate these outbreaks. And that's why the Task Force on Aging and Families and the House Democrats are turning up the pressure on the Trump administration to improve oversight and prioritize the distribution of vital supplies to nursing facilities. From PPE shortages to delayed testing to a lack of in-person inspections, we realize the failure to control the spread of coronavirus in nursing homes has many causes. I'm pleased to have Dr. Michael Wasserman join us today to share his expert insight on what can be done to promote maximum safety for nursing home residents and caregivers. Dr. Wasserman is the president of the California Association of Long-Term Care Medicine, an organization representing providers of clinical care to older adults living in nursing homes, assisted living facilities, and group homes across the state. He's board-certified geriatrician and editor-in-chief of an upcoming major geriatric medicine textbook. You have the floor, Dr. Wasserman.
Thank you, Congresswoman Matsui. Really appreciate that introduction. My comments today are my own and are based on my experience as a geriatrician, running the nursing home arm of a QIO and being the former CEO of the largest nursing home chain in California. In early March, the experts in geriatrics and long-term care medicine knew what was coming. The science that came directly from the CDC was clear. COVID-19 was lethal to older adults in nursing homes. CMS struggled to prioritize nursing homes for the resources necessary to keep staff and residents safe. Tens of thousands of the most vulnerable and cherished members of our society have died. Nursing home direct care staff, who barely earn a living wage, have also died while performing God's work. This represents a failure of leadership at the highest levels of our government. States and nursing home operators have struggled with pandemic-related supply chain dynamics. The federal government, whose prompt response was so desperately needed, failed to surmount the challenge and make PPE a priority for nursing homes. This remains an issue today. The real estate owners behind the nursing home industry also have the ability to leverage their assets to acquire PPE, but many chose to wait for the government response, which didn't happen. As a clinician, I don't care who takes responsibility for the acquisition of PPE. Without PPE, COVID-19 cannot be stopped. COVID-19 is a medical emergency. During such an emergency, clinical experts are crucial. The American Board of Post-Acute and Long-Term Care Medicine provides a certification for nursing home medical directors, yet only a fraction have this certification. For too long, this key position has been minimized. The negative impact of this has been amplified by COVID-19. CMS has requirements for nursing home medical directors, but many homes ignore them. Trained medical directors must be allowed to perform their duties without undue influence from nursing home ownership. There should be no quid pro quo related to admissions, and medical directors should be free to provide clinical and administrative leadership without fear of losing their position. Professional and stakeholder organizations have asked CMS to maintain a national registry of medical directors. This would be easy to implement, but CMS continues to deny these requests. It's time to change that and provide transparency to this important role. The government and nursing home industry must fully engage experts in geriatrics and long-term care medicine to protect our vulnerable elders. We need your help in assuring that we are active participants in policy and decision-making processes. If we had been heard and fully engaged, many lives could have been saved. I thank you for your attention to these critically important matters and your concern for our precious vulnerable elders. I look forward to answering your questions.
Personally, you've been so helpful to me and so many others. It's been great to see you on MSNBC with Rachel Maddow talking about this, and we need to partner with you to really come up with all the solutions that you know are so important. And thank you so much to my partner and to Doris Matsui for your comments and your leadership. Thank you so much. Right now, I am proud to and pleased to welcome Mr. Chris Brown. So Chris works at the Elevate Care Nursing Home in Northbrook, and that's in my congressional district. Mr. Brown offered moving testimony before the House Select Subcommittee on the coronavirus crisis earlier this month, and I am so grateful that he is joining us today with his testimony. So go ahead, Chris. Thank you.
Thank you, guys. Thank you. Thank you. Can you guys hear me?
Yep. We got you.
All right. Good morning to the members of this task force. I appreciate this opportunity to share my experience as a healthcare worker on the front lines. My name is Chris Brown. I'm a certified nursing assistant in a nursing home here in Chicago, Illinois. I'm proud to be an SCIU healthcare member also of Indiana, Michigan, and Kansas. I worked in the healthcare industry for about 10 years, but my experience as a caregiver started earlier before then. My first person I took care of was my grandfather with cancer. Taking care of him was how I first learned how much goes into providing quality care for someone with a serious debilitating illness. It was an entire family effort. When other family members were working, I was there making sure my grandfather had the medicine and all his physical needs was met. And I worked to meet his emotional needs as well, providing good health care and hands-on care as much as I can. We provided care for my grandfather until the day that he died. This was true with my grandfather, and it's true for nursing home residents that I care for today. I choose this work because I care in general. I found it to be very rewarding, but to be truthful, I have to say that at these nursing homes, I face a lot of challenges on the job. Many of these challenges existed before COVID-19. These challenges meant that residents and the workers who care for them went into the pandemic without everything we needed, which made the impact of the pandemic much worse. One of those challenges is short staffing. I work on the floor where most of the residents are bedbound and they cannot speak freely. It takes a lot of physical labor to move these residents, to make sure that they don't get bed sores and get the care that they need, the basic care that they need every day. We are already having to rush to clean, to move, take care of our residents just to give them what they need. And this was going on before COVID-19 struck. The pandemic has meant more work. We had added in new protocols for keeping residents and workers safe, but we haven't gotten more staffing. Our facilities created a special floor for residents for COVID-19, but we don't have the extra staffing needed to meet all the new work and demands that comes with the crisis. So as workers, we are doing more and more during a time of great stress. And with our lives quite literally on the line, we are each exposed to more residents, which means the risk and our risk of COVID-19 is increasing. We don't know if new residents are tested when they arrive, if residents are only tested if they show symptoms. By then, it may be too late. Certified nurses assistant in nursing homes don't make a lot of money. In fact, we're usually paid poverty wages. That was true before COVID-19, and it has caused a lot of daily stress for us, with most nursing homes and nursing home workers having to juggle bills in the best of the economic times. Sorry about that. Now we have additional stress. If I become sick, how can I take care of somebody? Who will take care of me? If I end up working sick, the virus could spread like wildfire. If I don't come in, I risk being able to not pay my bills and or losing my job. I have to choose between keeping the lights on or protecting my health. Being given low-grade PPE compounds these risks. I have more direct contact with residents than medical staff in nursing homes. Where I work, I am giving a single mask use where I have to ration that out and use for days before I'm able to get a new one. What is worse is that at the start of this crisis, we couldn't count on nursing home owners to give us the information we needed to keep ourselves, our families, and our residents safe. My facility had one of the first confirmed cases in 4 weeks before I found out about it. I never knew whether I came in contact with the patient. Eventually, I had to move out of my mom's house because my family was afraid of getting sick. I haven't seen them since. It's difficult not to be able to see the family. I have 13 brothers and sisters. We all work and we all take care of my grandmother who has dementia. Every day, my grandmother is losing a bit of herself, And in these last precious moments, I'm going to miss out because of COVID-19. But the time I'm not spending with my grandmother, I am developing relationships with people in the facility, unlike my grandmother. Many of these residents do have family. Sometimes we end up becoming the only family they know. I spend most of my time telling jokes, putting a smile on our residents' faces, and trying to keep them company. That's why we need to invest in nursing home workers, the residents, and to address short staffing. It's both heavy, emotional, and physical labor, but it will be easier to find people to do this if we are paid what we are worth, if we are valued, if this work is valued the way it's supposed to be. Our residents can live with dignity and comfort. Together, we can make my union family and everyone else a part of this building and a part of the healthcare system. We can make some progress. Nursing home workers across the facility have lobbied in Springfield, Illinois to share our stories and being understaffed and working without benefits. Just recently, we was able to win pay increases for nursing home workers for Chicago. Over 5,000 people was threatened to go on strike, including a $2 an hour increase for hazard pay, an additional 5 days of sick leave, because but it's still not enough. These are the things that all 5,000 members that we have threatened to strike to try to get the $2 for the COVID and these raises. These issues are not unique to my facility. Nursing home workers across the country state residents are not adequately protected from COVID-19. We were also calling for paid sick days, double time hazard pay, free testing for COVID-19 with the pandemic affecting communities of color, and acknowledging the majority of nursing home workers employed in nursing homes are Black and or people of color. Nursing homes workers are getting hit hard. I continue to pray that this change will be better and for our families because they depend on it. Thank you.
Well, thank you, Chris. You notice that when it comes to essential workers, you don't see any CEOs on that list. You see the people who go in risking their lives every day in nursing homes, people like you that do this incredible work. And it's true that SEIU Healthcare was able to get some concessions, but as you said, it's still not really enough, and we need to respect the work the incredibly precious work that you do. So thank you very, very much.
Thank you, Jan, and thank you to my fellow co-chair Doris for allowing me to represent my generation in this task force, as well as my own district here in Western Pennsylvania. We are the home of a nursing home in a place called Brighton, Pennsylvania, where we believe at least 82 of our community members have died. Hundreds more have been tested positive, several dozen staff. It has been really the epicenter of the outbreak here in Western Pennsylvania. And the tragic thing about this episode is how much it reveals about the underlying dynamics of these nursing homes. There have been 3 inspections at this home since the middle of April, 3. And by the middle of April, we knew a lot of what needed to be known about COVID-19 and how to deal with it in these facilities. But in those 3 inspections since April, they have found infection control violations in every single one of them. And in the second of those, which occurred in the first weekend of May, there was an immediate jeopardy violation, which is the most serious level of violation that you can have. So the fact that it is so difficult for a facility like this one to even comply with the basics of infection control, it tells you something about the leadership and management of the facility, obviously, but I know it's not the only place like that in the country. And one of the things that we know for sure, many of us have suspected it for a while, but just yesterday in the New York Times, there was some data making this crystal clear that better pay and working conditions among the staff of these facilities can go a long way, not just to making life better for the staff members, but making life better for the residents and actually prolonging their lives. And I recommend that piece to anyone that hasn't had a chance to see it, because the data was pretty compelling. You could actually quantify the number of additional years that you get as you raise people's pay and working conditions. And so I think it's those deeper structural underlying conditions around these nursing homes that this task force is really well suited to address. And I think the families of the 82 people who have been lost in my district All of them are crying out for justice in their own case. They want to know what happened and what was responsible, who was responsible. But you hear them every time saying they don't want this to happen to anyone else. And I think it falls on us as legislators to make sure that by addressing some of these things going forward about how people are cared for and about how staff are compensated and cared for, we can really make a long-term change. And it's time to do it. I mean, the demand for these services is only going to go up. So I'm very pleased to be able to introduce one of my constituents, a woman named Dr. Patricia Gennari, who was the superintendent and school administrator in the largest town in my district for about 16 years, someone who dedicated her life to public service and helping out this community. And Dr. Gennari is really here today to talk in personal terms about what has happened in some of these homes in our area. Her own mother passed away, actually not of COVID-19, but of some complications that were probably made worse by the fact that her family was cut off from her during the outbreak of this crisis. And some of the things, she's here to tell us about some of the things that nursing home facility went through and what it was like for her to lose her mother under these conditions and what we can do better, again, to make sure that this doesn't have to happen to anybody else. So I'm very honored to introduce Dr. Gennari and thank her for being here.
The floor is mine. Well, good afternoon, and I would like to thank Congressman Lamb for this opportunity. I'd also like to thank all of the representatives for your service during this very difficult time. My family's story during this pandemic is unusual but straightforward. 1 week ago today, at this time, we buried my beautiful, caring 95-year-old mother. She suffered with and embraced dementia and lived in an assisted living facility. This facility is exceptional, providing quality care. They have no cases of COVID-19 due to their extreme diligence. I visited my mother every day until March 18th. I was informed that due to the COVID-19 restrictions, in-person visits would cease. The staff was great. We FaceTimed, we did frequent window visits. Soon, my mother's behavior deteriorated. A normally mobile, very feisty, physically fine, COVID-19 free woman began sleeping all day, declining food, and withdrawing in general. When I finally saw her in person on May 29th, she could barely move. The next 2 weeks were excruciating. She made her transition on June the 12th. It was anything but peaceful. You see, even at 95, it was simply not my mother's time. The doctors told us that the combination of dementia and isolation proved to be too much for her. While not responsible for the virus, the administration did know that the virus was here in January. They told us that there were 15 cases and they would soon go away. And they knew that a nursing home in Washington was a hot spot, but they said there was no need to panic. Apparently, there was no need to plan or test or truthfully communicate, especially to the senior care facilities. This lack of action for those 2 months resulted in my mother, and I am sure many other seniors, becoming an inadvertent statistic of COVID-19. I can't change what has happened. I can observe that the same pattern of communication is occurring as we speak. June has become the new January. We are now being told that the virus is abating. I can interpret statistics. No, it is not. Actions can and must be taken now, and I would like to help in that effort. For instance, providing rapid testing to families so that they can consistently and safely visit loved ones is important. It is not a joke, it is a lifeline. Advancing visit protocols that follow CDC guidelines but mitigate isolation is important. Providing much needed PPE is also important since it is still not adequate. Providing accurate information, especially to high-risk facilities, is essential. I want to take this opportunity to thank Congress. I see your great efforts shedding light on this crucial issue. and taking responsibility can only help moving forward. Thank you.
Thank you so very, very much. That was very important testimony about the dangers, too, of isolation when we don't, in a timely way, deal with a crisis like this. So we're sorry for your loss.
Thank you.
Your loss, yes. Now it is my pleasure to introduce or to call upon a force of nature in our caucus, Congresswoman Debbie Dingell, who will introduce Toby Edelman, our next panelist. This has been fantastic. And so go ahead, Debbie Dingell.
How are you, Jan? It's good to see you. I guess people can't see me, but I don't know what's going on, so I'm sorry. But it's really great to be listening to everybody. This issue really, really matters to me. You know, many people know I took care of my husband for a number of years, whose mind remained very engaged until the minute he died. But I spend a lot of time with seniors, and this weekend I met with a group of seniors who reinforced for me what I have been hearing and what really, really worries me during this pandemic, that they think that we've made a decision that they're disposable, that if they get COVID, that we don't care if they live or die. They're feeling isolated, that there's no one that cares about them, that they don't have any advocates. And that's why what we're doing today is so important. You know, so many people that are in nursing homes, we've seen good nursing homes and we've seen bad. In Michigan, more than a third of the deaths have been in nursing homes, and we can't go visit. We can't be the advocates. We can't make sure that they're okay. And yet we have to do that for all the reasons that everybody's talking about today. So this crisis has really exposed the cracks in our current system, and we're not meeting the moment. We have to do better. The HEROES Act, with the work of all of Jan, does such a fabulous job, as do Doris and Connor as chairs, and we're a team, and we're working to do things. The HEROES bill has strong provisions in it to increase the testing capability, to put in nursing home oversight, as well as funding for community-based care and to address the PPE issue. But the Senate's got to do something. And in the meantime, we have people out there that think we don't care. They're afraid. And we all have a responsibility to let them know we do care. They're not alone. We have other ways to be their advocates and to check in on them. So while we're watching this, I want to take the opportunity to recognize our panelist, Toby S. Edelman, who has decades of experience representing people that have long-term care issues, who understands they need to have a voice and is their voice. Ms. Edelman currently serves as senior policy attorney with the Center for Medicare Advocacy and provides research, policy analysis, consultation, and litigation support relating to nursing homes and other long-term facilities. We look forward to learning from her experience and perspective, and thank you for joining us today.
Thank you, Congresswoman Dingell, for that introduction. I work as a senior policy attorney at the Center for Medicare Advocacy, which is a nonpartisan, nonprofit, public interest law organization that works to get full coverage for people, older people and people with disabilities under Medicare, and high quality care. And I have personally been working as an advocate for residents at the national level since 1977. So it's 40 plus years and counting. Unfortunately, the deaths of more than 50,000 residents and staff members are what have brought enormous public attention now to nursing home problems. And as Mr. Brown just so eloquently said, these problems were not new. These problems predated the COVID crisis, but with COVID, the door has been open very wide for everybody, and we are all seeing how serious these problems are. What we're actually seeing now is a lot of finger pointing, and there is more than enough blame to go around. We know that residents were at high risk at the beginning of this pandemic. Residents are generally of advanced age and have multiple health conditions. But the situation did not have to be this bad. We did not need so many deaths to happen. Researchers that I trust are finding and reporting that facilities with low staffing levels, historically poor quality of care, and poor infection control practices are more likely to get rampant COVID-19 outbreaks. Facilities are not without blame in this situation. But probably the biggest problem that we have seen is the lack of federal leadership. States have been left entirely on their own, and they are competing with each other for tests and personal protective equipment. Since January 2017, the Trump administration has been cutting back on the 1987 nursing home reform law, especially the enforcement system, which was able to reduce and pretty much trivialize so that we have almost no enforcement going on. But there were limits to what it could do unilaterally. In the last few days, I've been preparing testimony for Thursday's hearing in Congressman Doggett's Health Subcommittee of Ways and Means. What I'm writing about is how the administration deregulated nursing homes. And now, during the pandemic, how it has waived many parts of federal law that it ordinarily could not waive unilaterally. For example, we've lost many resident protections. Residents are not able to see their families. Families have been barred for more than 3 months from visiting. We have seen changes on the limits to involuntary transfer and discharge. And as Congressman Lamb said, yesterday's New York Times had a very troubling article about facilities moving residents out to homeless shelters in order to bring in people who had COVID-19 where they could get more reimbursement, higher reimbursement. Very frightening. Another important protection that has been waived is the requirement that nurse aides who provide more than 90% of the direct care to residents, that nurse aides have at least 75 hours of training and are competent. That is waived, and we are seeing people come into nursing homes who do not have that training, who don't really know how to provide appropriate care to residents. The administration has also waived some provisions that it wanted to waive. So not only are families and ombudsman barred, but surveyors have been very limited in what they're supposed to look at. They're supposed to look at only immediate jeopardy violations, and that's maybe 1% of the violations that are ever cited, and infection control. On June 4th, CMS released about over 5,000 surveys. Only 20 of them reflected immediate jeopardy. The rest were supposedly infection control surveys. But of those more than 5,000 surveys, less than 3,000 cited any infection control deficiency. This statistic seems completely implausible. The General Accounting Office had just reported weeks earlier that 82% of facilities were cited with at least one infection control deficiency in a 5-year period, and that 48% of them had violations in multiple years. In fact, infection control is the #1 deficiency cited in nursing homes, and the #1 problem is hand washing. CMS has also told facilities in all these cutbacks since March not to report resident assessment data, not to report staffing data, even though staffing data are now based on payroll, which of course facilities need to know what they're doing. Facilities may never have to report this information ever. So we will not be able to figure out what went wrong and how to fix it if we don't even know what actually happened. What we have now is a very lethal combination. We have waiver of protection for residents, no one overseeing care, no families, no ombudsman, very limited visits by state survey agencies, lots of money being given to facilities. The administrator said about the first $1.5 billion that nursing homes were getting, there are no strings attached. Do whatever you want with the money. And finally, at the state level, and maybe soon at the federal level, there are calls for immunity from liability. This is a lethal combination for residents. I think it's not too soon to think about how to undo the damage that has been done, although of course we can never get back all the people we have lost. But I hope that next year Congress will be able to effectively channel public outrage into necessary changes to reverse course and protect residents and staff lives. Those of us who advocate for residents will be here to do whatever you need us to do. Thank you very much.
And thank you, Toby Edelman. You've been helpful to me on a town hall meeting that I had, and really, really appreciate your expertise and the way that you explain it and the clear passion that you have for protecting residents and workers in these facilities. And now it's my pleasure to welcome our a vice chair of this caucus, someone who cares a lot about seniors and has a lot of seniors in his Florida district, Ted Deutsch.
Great, thanks. Thanks very much, Jan. I appreciate it. It's really nice to be with everyone, and thanks to my colleagues, to you, Chair Chakowski, and your fellow co-chairs Matsui and Lamb, and Caucus Vice Chair Clark, and all of the vice chairs and all of the guests today. And especially, I just wanted to take a moment, as terrific as all of our guests have been, I want to acknowledge Chris Brown for the really heroic work that he and so many other SEIU workers are doing every day. And Chris, it's clear how much you care for your own family, and it's also clear that you have the same respect for the residents that you take care of. And you're right. What this whole call is about is ensuring that our seniors are treated with dignity and respect and are comfortable. And that's what you do, and that's what we're all trying to do. I very much appreciate the guests sharing their firsthand stories of expertise. We can't let seniors and those with disabilities quietly endure the brunt of this crisis. It's been 100 days in Florida since Governor DeSantis ordered Florida's nursing homes closed to visitors. 100 days without any family and friends. 100 days just hoping that a video call is enough. And those 100 days were supposed to be spent slowing the spread and planning to get COVID-19 under control. We were supposed to focus on testing and tracing and isolation. Those are the tools that we have now. But here in my state, in Florida, Governor DeSantis has failed to use the past 100 days to put a comprehensive plan in place. Instead, he blamed farm workers with racially charged rhetoric. He blamed young people. He blamed the media. And it is the most vulnerable Floridians who are paying the price. Residents and staff of long-term care facilities account for more than half of the reported deaths in our state, over 1,600 lives lost. And yes, the average age of new cases going down, and deaths have not spiked, certainly not yet anyway, but cases are skyrocketing and setting new records multiple times last week. Florida confirmed a total of 22,000 cases in the past 7 days. And it is our older family and friends, our most vulnerable neighbors, who are stranded in isolated islands throughout our state inside nursing homes. And even if isolation has protected many, the governor has failed to chart a course for relief from this harsh lockdown. And now we're in a far worse position, bracing for what the coming months will bring. My message today, and the reason I'm so grateful for this opportunity, is that we can't protect our nursing homes unless we get the fundamentals right. We can't give up preventing outbreaks because it's mostly younger people, as the governor pointed out, and expect that Floridians in nursing homes will be okay because they're locked away. That's not acceptable. It's not what aging in America should look like. I hope that the powerful testimony from our witnesses today will help remind everyone of that. And I'll now turn it back to Chair Chakowski. Thanks, Jen.
So much. I think that Ayanna Presley is not coming, so I think all of our vice chairs that are here have spoken, and we're going to open it now to questions. And if you don't mind, I'm going to ask one first before I have to leave. So thanks for the indulgence. You know, I wanted also to address myself first to Mr. Brown. And as Ted Deutsch said, you know, really, we called our legislation the HEROES Act, and we mean a lot of people, but getting up every day in the morning, going off to work, and knowing that this can be a very dangerous proposition. Let me just ask you, of all the things that we need to do, where would you, what's the thing that you think you need the most? Is it PPE? Is it more testing? Is there one thing that we could try and get right the fastest?
Thank you for your question. That's a really good question, and kind of a hard question because it's all needed for cohesively to work effectively to do what needs to be done. Outside of that, if I had to pick one thing, the one thing I will say is far as sick leave or having those days available to us. My biggest concern was if I do have COVID-19 and or if I have to have any symptoms and I have to quarantine for 14 days. My biggest thing was how was I going to continue to pay my bills, or how was I going to do anything, even take care of myself while being sick, and if I am sick, who's going to take care of me? So my biggest issue was being threatened in most of these jobs. A lot of these people across the country are being threatened that if they don't come to work, they're going to lose their job. So that's an issue.
Yeah, thank you. Let me ask a question that I've been dealing with for a long time. I have a bill called put a nurse in nursing homes, and I was talking about registered nurses. Do you think, Ms. Edelman, that it would be helpful if there were, in fact, a full-time registered nurse in nursing homes?
Absolutely critical to have registered nurses 24 hours a day in nursing homes. Now the only federal requirement is a registered nurse 8 consecutive hours a day. That means just the day shift. So people get sick in the middle of the night. They get sick at other times. And there are certain assessments of residents that only a registered nurse can make. I mean, we rely on the certified nurse assistants who really know the residents better than anybody to identify something that's a problem. Somebody doesn't look like herself. But if Mr. Brown doesn't have the registered nurse to go to talk to say, here's what's going on, I think you should take a look at her, we're not going to get good care for people. It is way past time to have nurses in nursing homes.
Yeah. Not to diminish the great work of people like Mr. Brown, but I think that's right. Doris, I'm wondering if for future comments and questions, if I could turn it over to your very able leadership at this point.
Certainly, Jan, and I want to thank you so much. You're such a great partner and such an advocate. I really enjoy working with you. So thank you very much.
Thank you. I love you too.
What I want to do now is ask a question, and then I'll open up for questions. We heard today, and it was also reported over the weekend, that nursing home facilities are increasingly evicting old and disabled residents, really sending our most vulnerable from hotbeds of the coronavirus to homeless shelters, rundown motels, and other unsafe facilities. Dr. Wasserman, Dr. Wasserman, I want to ask you, what incentives or pressures are influencing nursing facilities' decisions to evict residents during the pandemic?
Yeah, Congresswoman, thank you for the opportunity to answer this. Back in March, when COVID started, based on my background and experience, I was actually quite worried that this type of behavior could and would occur. And so when the story came out, it didn't surprise me. I do want to say, and I also really want to thank Mr. Brown as well, because the CNAs, the folks on the front lines are doing incredible work. And I think we need to realize that the situation we saw in that article is not the norm. It represents the bad apples. But keep in mind, there are bad apples, and this should not ever happen. The other thing about sort of what the bad apples are getting away with is that they, in my mind, highlight a couple of fundamental problems in the industry. And the first problem which I spoke a little bit about in my opening remarks, is nursing homes are places where we're supposed to care for frail older adults. And surveyors can only do so much after the fact through oversight. We need to work to prevent this type of behavior. I think the 24-hour RN is important. I think doing all the things to support our CNAs are important. At the same time, the medical director, who by statute is supposed to be the clinical leader in the nursing home, has literally been kept out of leadership management and decision-making. And we believe that making sure that the medical director is fully engaged is actually the quickest way to bring about fundamental change to care quality. And in many ways, it could be the first line of professional oversight.
Well, could I ask you this, Dr. Wasserman? Under federal law, are these discharges legal?
Well, no. And I think that the challenge is,
well, what enforcement action should CMS be taking to immediately halt this behavior?
Well, again, I think one of the problems is unless you have clinical leadership in the building calling this out, facilities manage to come up with reasons and excuses on why they're doing it. And I think we need to be identifying and calling it out and recognizing that the administrators, the staff in facilities are under tremendous financial pressure. And that drives a lot of this type of behavior. And the industry will tell you they don't make much money on operations, and they are correct in that. However, there's plenty of profit on the real estate side and in non-transparent related party transactions. And that's where the financial benefits actually are accruing in the industry. And until we deal with this transparency, so what I want to point out is, until we get to the transparency issues, it's really going to hamper efforts for enforcement and oversight to deal with the bad behavior and the bad apples in the industry.
Well, Dr. Wasserman, we would like to work with you to root out this and figure out how to make people more transparent so we can actually have more enforcement here. Okay. Listen, I really want to thank all the presenters today. We had a wide range of people: Mr. Brown, Dr. Wasserman, Dr. Gennari, Ms. Edelman, who gave us a sense of the challenges that we have. But what the task force really feels is that these are people and their families, and all of us are a family situation, where the people who are in the facilities are there because we love them and we expect them to be taken care of. And what the task force is really actively involved in is to ensure that we have quality care as we move forward. And what the COVID crisis has brought to light is the fact that these facilities are not acting in good faith in many cases. There might be some good ones, but when you lose, and I can tell you in my state of California, half the deaths are in nursing homes. And that's ridiculous, absolutely ridiculous, because we have about 1% of the people in nursing homes. And when you think about half the deaths are in nursing homes, it's absolutely unbelievable. We care about our families, we care about the people who've taken care of us, and it's really very, very important that we together work together. And I want to thank very much Mr. Brown for being such a hero. And we want to help out because caregivers are so important. You have to think about your own family at the same time. The people you cared for were your own family too, and we depend upon people like you. You know, and Dr. Wasserman, we need your expertise, and we want to work with you on how we improve these facilities. And Ms. Edelman, you are fantastic. I mean, you've been there for such a long time. And Dr. Gennari, thank you so much for bringing that human aspect too. I was also watching some of the people that I knew who couldn't see their loved ones and had to go to windows. At least they have windows there. But also when they on, couldn't really say goodbye to them. And you think about people's lives, think about the fact that these are people who've taken care of you for so long and sacrificed and not being able to even say goodbye. So we want to work with you. Thank you so much. I thank my colleagues for being on this roundtable with me, and let's work on this. Let's ensure that our loved ones have the best care possible, and that we can stay in touch with them, communicate with them, and make sure that they're safe. So thank you so much.